How to get nice feet. Feet are subject to a lot of damage due to day-to-day activity. If you feel your feet are calloused, dry, or otherwise damaged, there are many steps you can take to improve the overall appearance of your feet. Method 1. Repairing damage. 1. Remove calluses and rough skin. Feet often end up calloused or rough with time. If you want to improve your feet, you can smooth out your skin using an electronic callus remover, a foot file, or a pumice stone. An electronic callus remover is a motorized device that you move over calluses and rough spots on the feet. It removes dead skin cells and shaves down the rough, outer layer of skin and leaves your feet smooth. A callus remover is fairly efficient, but can be somewhat expensive in comparison to other options. A foot file is a metal device that you use, much like a nail file, to wear down calluses and rough skin on feet. Foot files are relatively inexpensive and can be purchased online or at most beauty stores. Pumice stones are spongy devices that you can rub over to remove calluses and rough skin. They are probably the cheapest option for treating calluses, but are less effective than other options. They can be purchased online, or at drugstores and beauty stores. Look into getting callus removal gel and use it alongside one of the above methods. It can help increase the efficiency of an electronic callus remover, a foot file, or a pumice stone. 2. Stained toenails. Toenails frequently get stained by dirt and debris. If you're worried about discolored toenails, you can use household supplies to remove stains. Toothpaste, whitening strips, and hydrogen peroxide can all be applied to toenails to remove stains. Dap a cotton ball with hydrogen peroxide and gently swab your toenails. Let the liquid sit for 5 minutes and then wash it off. Your toenails should look clearer and cleaner. You can also use toothpaste or whitening strips in a similar fashion. However, such substances may need to be left on for a bit longer than 5 minutes. 3. Treat blisters appropriately. If you have blisters, you should not try to remove them. Instead, treat them in a way that promotes healing. Keep the blisters clean and protected. Wash them every few hours and then cover with a fresh Band-Aid. Use antiseptic soap. When at home, take off your shoes and socks and remove any bandages. This will allow the blister space to breathe, which can promote healing. Method 2. Caring for your feet. 1. Do regular foot soaks. Feet are susceptible to a lot of damage throughout the day. If you want to maintain nice feet, you should do foot soaks a few times a week. There's no precise formula for a foot soak. You have to focus on what feels nice to you and your feet. Many people find mixing warm water with Epsom salt, sea salt, essential oils like chamomile, or ground oatmeal helps their feet feel soft and clean. Aim to soak your feet around 10 to 20 minutes. Any longer could dry them out. How often you engage in foot soaks depends on your lifestyle. If you're very active throughout the day, a nightly foot soak might be a good idea. However, if you're mostly sedentary, you may be able to get by with a foot soak a few times a week. 2. Exfoliate on occasion. Exfoliation is a process where dead skin is removed. It's important to exfoliate your feet on at least a weekly basis, as feet are particularly likely to harbor dry, dead skin cells. You can exfoliate your feet buying special products or gels from beauty stores and drugstores. You can also use homemade scrubs using sea salt or other household products. Ideally, what substance you use to exfoliate should be somewhat grainy, as this helps to remove dead skin. To exfoliate, rub a gel or homemade scrub into rough patches on your feet. Focus on heels, between the toes, and the edges of your feet. Scrub hard until you can see some dead skin flakes peeling off. Rinse your feet in warm water afterwards. 3. Moisturize. A good moisturizer is important to adequate foot care. Feet dry out easily. If you want your feet to look their best, moisturize on a daily basis. You can find foot moisturizers in most beauty stores. You can also use regular lotions or moisturizers that you use for other parts of your body. However, moisturizers made specifically for feet may be more effective as they are more powerful. The skin on feet tends to dry out easier than on other parts of the body. Moisturizer after soaking or exfoliating your feet. You should also moisturize after a shower or any activity where your feet got wet. 4. Wear proper shoes. You should always wear shoes that fit you comfortably. Shoes that pinch or are too small can irritate your feet and cause damage. Make sure you always get shoes in your size that are comfortable to walk around in. Method 3. Seeing a specialist. 1. Consider a pedicure. Particularly dry, cracked, or damaged feet may benefit from professional treatment. Make an appointment with a pedicurist if you think your feet would benefit from professional treatment. 2. See a dermatologist if you notice any unusual marks. Melanoma, an aggressive form of skin cancer, can start under your toenails. If you notice unusual moles or freckles growing under your toes, make an appointment with a dermatologist for evaluation. When caught early, melanoma is highly treatable. 3. See a doctor about fungus. If you have foot fungus under your nails, it will appear as a yellowish tint. It will not respond to cosmetic stain removal treatments. See a doctor and go over treatment options. Your doctor might recommend oral anti-fungal medications, medicated polish, or medicated cream. Take any meds prescribed according to your doctor's recommendations. Ask any questions at the pharmacy if you're confused about the medications. In rare cases, toenails may have to be surgically removed if they do not respond to medication. In this case, your doctor will go over surgical options and how to prepare for the surgery and recovery.